Barnes, thank you very much. So will this new health plan really be a way of saving money on health care, or just a move that will get us further in debt and closer to socialized medicine? Let's ask Dr. Michael Burgess. He is a Republican congressman from Texas. And on the phone, Representative Jan Schakowsky, a Democrat from Illinois, and she is there for a vote. Let me go first to the doctor, if I could. You heard the administration's argument that they say spending now will save us all money in the long run. Do you buy it?
Well, you learned at your mother's knee, an ounce of prevention buys a pound of cure. The question is, where is that ounce of prevention, and how much does a pound of cure actually cost? Look, none of us wants to do things that are inherently unhealthy, but we all make choices every day that perhaps don't lead us down the road to best health. There are things we can do as a provider community that will improve that. Now, what we should be doing as legislators is perhaps an entirely different tack. And although we have the white paper today, bear in mind we have not seen, I'm a Republican. We get a lot of grief for not having a Republican health care plan out there. In fact, we got a little grief today because there are too many now Republican health care plans out there. But we have not seen the proposal from the administration, from the leadership of the Democrats, the Democratic leadership in the House or the Senate. Realistically, they won the election. They won the election on this issue. It is incumbent upon them to show us now what that means.
Okay. Well, Congresswoman Schakowsky, I know at least what Barney Frank wants. He said he wants a single-payer system, something akin to Medicare for everybody. That's what he said on Fox News Sunday a few weeks ago.
Yeah, that's not the proposal. It's going to be.
Okay, what do you want, Congresswoman?
What I think will emerge will be giving consumers a choice of a private health insurance plan like the one they have, or another one that they'd like to choose, or having a public health insurance option. But you were talking about the number of people who are uninsured. I talked to a farmer last month who was telling me that he has a $10,000 deductible. That's all he can afford for his family. He's counted as an insured person, but in fact, for most things, he really isn't insured. And there was a study that showed that over half of Americans either postponed or did not have some kind of a health procedure or fill a prescription. They went without sometime during the last year, 52%. So to say that Americans are sufficiently covered right now is to absolutely ignore the crisis that's out there. So what the Democrats want to propose is a choice for Americans between a public plan and a private health insurance plan. And of course, what Representative Burgess and I are co-sponsors also of a bill that talks about Health Promotion First Act. He's absolutely right. We also want to make ordinary people responsible for their own health too, and we want to promote a healthy lifestyle that will save money in the short run.
Okay, but Congresswoman, you said you're not in favor of the single-payer plan that Barney Frank said he was in favor of, but you're quoted as saying exactly that. I know that many of you here today are single-payer advocates, and so am I, and you repeated, so am I. So you've said it in the past that you're in favor of single-payer health care. Have you changed your views?
Well, no, what I'm saying is, as a practical politician, that what I think is something that will be acceptable now to the American people and something that can pass the Congress is giving people a choice. So, sometimes it doesn't matter what we think would be the ideal world if we ran things, but something that will actually work as an American health care plan. And I think
all right, let me get Congressman Burgess back in here, because what scares a lot of Americans is what they've seen with GM this week. They've seen a government move further and further and further down the road to nationalizing industries, and they wonder that, yes, now they come out with a proposal that isn't exactly single payer. That's the goal. That's the goal of the Congresswoman. That's the goal of Barney Frank, and perhaps that's the goal of the president long term.
Right. If you like what you've got, you can keep it right up until we take it away from you. Look, we get criticized so much in this country because we spend more money on health care, and And we're going to spend even more, and that's going to be our solution to it. I don't know what the figure that the Congressional Budget Office is going to come up with that this is going to cost, what the administration and the Democratic leadership may propose, but it's on the order of $1 to 2 to perhaps $3 trillion over the next 10 years' time. It's an enormous amount of money. All I would say is let's be sure number one, we get what we want, and we're getting what we pay for. I don't think going the public option route, the government-run insurance company route, is the correct way to do that. We've got that with Medicare. We've got that with Medicaid.
Right,
and look at the problem. Look at the problems that we have. Medicare works because the private sector cross-subsidizes it to the point you could not run your practice on Medicare or Medicaid today.
Congresswoman, not only that, but if you're prepared to say it works, you have to acknowledge the Inspector General's reports time and time again of fraud and waste in Medicare, which adds up to about 20% of the total.
Yeah,
that's about a $20 to $30 billion cost of waste and fraud in just 1 year.
Yeah, it's mostly provider fraud. But if you look at the insurance industry, they've had all this time to make sure that Americans get affordable quality health care, and yet there are millions and millions of people who are left out altogether, and millions more who have inadequate coverage. Talk to people on the street, ask if they want health care reform, and Republican or Democrat will tell you
well,
that
of course, if you use the word reform, Congressman, everybody wants reform. There's nothing wrong. But you ask them if they want single-payer system, something like what they have in Canada, and most Americans will say, no, we don't.
Well, they're not going to get that. They're going to get an option. They're going to get a choice, and that's the way we should go.
Okay, let me ask the doctor here. Will it be a choice?
All right,
thank you very much, Congressman. By the way, we should mention she took time out, and the congressman did cast his vote and then ran right over here, so we appreciate you doing that.
Sitting here under a severe thunderstorm alert just to be with you.
It looks like the clouds behind the Capitol are not only figurative but also literal here. But what about the idea that eventually you're going to find a system that Americans don't like, that if they make a decision now hastily, that if the government does that, eventually we are going to be put on a road to socialized medicine?
Well, I heard it over talking to someone on the Senate side just a little while ago. Speed kills on the Senate side. They don't like to move fast, and there's a good reason for it. You go fast and you make mistakes. Look, would anyone, if you could go back magically 43 years in time to when the Medicare program was constructed right across the street here in the United States Congress, would you construct a program that is going to bankrupt the country in just a few short years? The answer is, of course you wouldn't. You would have put a much different...
But the Congresswoman said everything's hunky-dory with that.
Yeah, well, up until the point where we can't pay for it any longer, and then we'll have to make some very difficult choices.
And we're reaching that point very quickly, aren't we?
You mentioned Canada. Canada is a great case in point. Their public program is under a budget. You get to the end of the budgetary year, the money runs out. Guess what? Your health care runs out. So all doctors take a vacation at the end of the year because it's the only sensible thing to do. And families know they'd better get their health care done early in the budgetary year, because if they wait till late, they may not be able to get it done.
Now the Congresswoman...
We don't do that in Medicare. We pay every bill that comes across the counter.
The Congresswoman was saying that Americans would have a choice under the Democratic proposal. They could either choose their private policy or go to the government policy. Will they have that choice?
At least initially. It's the old analogy of putting the frog in the pot of water and turning the heat up ever so slowly. The market will find a way to either coexist with a government-run program or it won't. And here's the difficulty: with the taxpayers subsidizing the government-run program, there's no backstop. A private company will reach a point where it's either its stockholders or its bondholders or debt holders who say, you cannot continue to lose money at this rate. We're going to find somewhere else to invest. The government has no such constraint. Maybe that's why they took over General Motors. There's a bottomless pit called the United States Treasury, and until it runs dry and our creditors then refuse us, it's a pretty stable source of income. It is a pit,
but it's not bottomless. There is an end to the game that's been playing, and it's just a question of how soon that end game arrives.
And what it looks like. That's correct.
Dr. Congressman Michael Burgess from Texas, good to see you. Thank you very much. Let's bring in our panel. Christina Rasmussen.